skull base osteomyelitis. It is the other name given for the external otitis, and it is caused by Pseudomonas but not by Staph aureus, and all other statements are true. Now, cochlear implant, typically which part is basically implanted while you are doing surgery? Many times this was asked, even recent AIIMS also. Receiver stimulator. So you have an external, internal, two components in the cochlear implant. Internal component contain the receiver and stimulator is what you need to basically remember. In neonates, for the hearing, what is the screening test of choice? Otoacoustic emissions. You also have a choice of answering BERA. BERA also is used for screening, but otoacoustic emissions are much more precise answer. Then pseudomembrane on the tonsil, what is it because of? It is basically caused by gram-positive bacilli. So you have gram-positive, catalase-negative cocci, which are known to lead to membranous tonsillitis, and also alpha-hemolytic streptococcus pneumonia is another important group of organisms which you need to remember. Even diphtheria. But what is the difference? When membrane is caused by gram-positive organisms, it does not cross. It is only restricted to tonsils. Whereas if it is caused by the diphtheria, it will extend beyond the tonsil, all the way involving the soft palate. That is the fundamental difference between the two. Anthracoinal polyp, what is the clinical management of it? Presently, the best treatment is functional endoscopic sinus surgery with polypectomy is considered to be the management of choice. I have seen the general medicine questions which are my core branch, but really utna lagatar questions nahi dikhaya. General medicine generally is considered to be fanatically composed in National Institute exams. Okay, who is the father of evidence-based medicine? Sackett. Then where is ANCA positive? Biscuit question. Wegener's granulomatosis. So you are having C-ANCA, P-ANCA. So P-ANCA is found in church straws, primary sclerosing cholangitis, then polyarthritis nodosa, etc., etc. This is a really interesting question, clinical question. Not the same diagram, similar, some concept is more or less same. This is a normal person drawing, that is you who is a neurologist. This is your patient drawing it. Looking at this, what is the possible tremor that the patient is having? It was a cerebellar tremor. Classically, if you ask a cerebellar tremor patient may, at the initiation of movement, end of the movement में tremor होता है. In the initiation of the movement, you can see this part, patient started here. So here he had a tremor. After that, it was smooth. Towards the end, once more he had a tremor. You don't have tremor there, you don't have tremor here. Only in the beginning only you had a tremor and the end of the movement. Intention tremor, which is basically cerebellar tremor. Suppose if the same diagram would have been drawn by a patient who has an essential tremor. Essential tremor. Give me the board. So this is the normal you have drawn, normal neurologist without any tremor about examiner. Suppose if the patient has drawn the circle like this, then that is an example of an essential tremor which is there throughout the motion. Okay. Suppose if it is intention tremor, then the point where he is starting the drawing, it will be there, it will come smoothly. Last part may once more he will have a tremor. Tremor only at beginning and the end, not throughout. That become intention tremor, which is cerebellar dysfunction. Okay, doctor? So that's how neurology is all about. Few pens, one torchlight, one fundus, one hammer, one tape. Tape to look at the optokinetic nystagmus. Bas. You will start enjoying calculating like mathematics, where is the site of lesion, and a good history. Then doctor, a lung biopsy is showing intranuclear basophilic inclusion bodies. Right. So what is it most likely to be? CMV classically will lead to that. So all inclusion bodies are a favorite area, doctor. Intracytoplasmic eosinophilic are what? Negri bodies, Guarneri bodies, Henderson, Patterson bodies in molluscum contagiosum. Intranuclear acidophilic are what? Intranuclear basophilic are what? And both of them are what? ये तो लिस्ट आप पढ़ना ही पड़ेगा. Cowdery type A, Cowdery type B. You have to read, remember, reproduce. Different shocks. What is the difference? If it is a neurogenic shock, typically what will happen, doctor? Patient will have hypotension. Whenever we have hypotension, what our autonomic nervous system will do? It will accelerate the heart. But neurogenic means there is a paralysis of that. So tachycardia won't be there. Bradycardia and hypotension is what you will typically come across in case of neurogenic shock. What is the definition of multiple myeloma is the common question of the examiner. Clonal plasma cells more than 10% is the golden figure, which you should not forget, which defines the symptomatic myeloma. Symptomatic myeloma. Along with that, any evidence of end organ damage, you can remember with the acronym CRAB. C for hypercalcemia, R for renal insufficiency, A for anemia, B for bony lesions, which are lytic bony lesions. Defines the symptomatic multiple myeloma is what need to be remembered. Then what defines asymptomatic? I leave the literature for you. Then what is international staging system? A lot of times questions are asked even on this. Now, hepatitis B, how will you make a diagnosis very early, doctor? HBsAg is the first one to become positive, right? So, it typically become positive within 1 to 12 weeks, usually between 8 to 12 weeks is what you need to remember. After HBsAg appear, after about 1 to 2 weeks later, anti-HBC will come. There is no HBC found, right? Then, gouty arthritis may needle like urate crystals, no big deal. This is what I am telling. RDS may what is damaged? Don't tell type 2, type 1. But surfactant is produced by type 2, that's the point. Then doctor, right atrial overload, agar hai to, how do you define it based on the P wave height is an important question. Give me the board. Typically doctor, I think you all remember our long one of the Sunday CCG class, right? V1 होता है, V6 होता है, V1 कहाँ रहता? Right side में रहता. V1, V2 are right, V5, V6 are left, V3, V4 are called septal, right? So whenever you look in V1, what do you have? Typically right atrium will lead to positive deflection, left atrium will lead to negative deflection, right? So any P wave height, if it is more than 2.5 mm, then basically what is the definition? That defines what? That defines right atrial overload is there, okay? So M type of pattern when left atrial hypertrophy is there. P mitral, so where will you see P mitral? All those funda in ECG, you can have a review in the anatomy to medicine video library. In cardiology, we have a ECG review. Pancreatitis is caused not by islet cell hyperplasia, but due to atrophy. But there is one genetic defect of trypsinogen which is implicated. Trauma can lead to pancreatitis. Hyperlipidemia can also lead to pancreatitis. One CT image was given like this. Actually, it is a pontine hemorrhage. So the question of the examiner is, What do you expect in pontine hemorrhage? We can expect pinpoint pupils, we can expect visual dysfunction, and through Pons what is passing? Through Pons, spinothalamic tract is passing, trigeminal is passing, etc. So loss of pain and touch will be there because ultimately right side Pons affect ho gaya to ascending tracts which are bringing sensation from the left side. See, dorsal columns comes ipsilaterally until medulla, but at medulla it will go to contralateral side and go into Pons. No, agar left ka Pons affect ho gaya to right side pain touch is gone. Spinothalamic tract to spinal cord level में ही decussate होके Pons को चलेगा, तो left Pons affect हो गया तो right side pain get affected. So contralateral pain and touch will be affected, but bladder dysfunction won't be there if the hemorrhage is in the Pons. Then cardiovascular disease, if you take more potassium, tomatoes, good for BP. Physical activity, good for BP. Moderate alcohol, good for BP, but don't write it in prescription. So vitamin E supplementation is not implicated. एक क्वेश्चन JVP के ऊपर नहीं है तो हम कोचिंग देना बंद कर देंगे. Definitely one question will come. V wave in left atrium, why it is generally higher than the right atrium? First of all, V wave is what? Positive wave. Why will V wave will basically occur? Atrium relaxes and receives the blood from great veins. So the filling of that blood will raise the pressure inside the atrium. So that leads to development of V wave, which is a positive wave. A wave, C wave, V wave. Towards the end of the diastole, last 1/3 of the ventricular diastole, when ventricle is getting filled from atrium, atrium contracts and pushes blood. That leads to A wave. Uske baad atrium relaxes, pressure falls down, X descent. Then great veins will drain into it and fill it. So pressure rises, V wave. Then tricuspid opens and blood leaves. So Y descent. Simple, right? So if you take left versus right atrium, left atrium if you take, it is habituated to living in which kind of situations of life? उसके daddy ventricle जो है, very angry daddy. For any small thing he shouts. Right atrium is habituated to live with very, very, very jolly type of father, right ventricle. तुम भी 2 pegs ले लो, मैं भी 2 pegs लेता हूं, kind of dad, right? और लेफ्ट एट्रियम कैसे जिंदगी का आदत हो गया, मंदिर को जाके कोकोनट वाटर पिए तो भी डैडी विल बी शाउटिंग. So that kind of thing is left atrium, right? So left atrium naturally only muscle is very thick, it is less compliant. Any falling of blood into that will raise pressure more compared to that of right atrium. Hence V wave is more prominent in the left atrium compared to that of the right atrium is what we need to basically remember. What is the first sign of spinal cord compression in case of TB? TB lead to paraplegia, Pons paraplegia. Initially pain is the initial symptom of the spinal cord compression, and pain is a sensory component, and involvement of sensory component is a early part of the Pons paraplegia. Patient typically prolonged immobilization shows tricuspid regurgitation. Prolonged immobilization की वजह से DVT हो जाता है, DVT से pulmonary embolism हो जाता है, pulmonary embolism से right ventricle के ऊपर pressure लग जाता. Right ventricle is putting pressure back on right atrium and leading to tricuspid regurgitation. Presence of tricuspid regurgitation is an indication of high right ventricular systolic pressures which occur because of the pulmonary hypertension, which is occurring because of pulmonary embolism. So examiner is indirectly asking you, can you know, do you know that any tricuspid regurgitation is an indicator of pulmonary hypertension? Okay. So in that situation, what do you want to do? Pulmonary embolism may. First thing is heparin, intravenous heparin is what you need to basically administer. So, yeah. So, doctor, once more, if you look at medicine topics, as I told you, what is pulmonary embolism status? जरूर आने वाला टॉपिक है, अगर वो नहीं है तो सोचने की बात है. What we expected but did not come in AIIMS May 2014, MI was expected. एग्जामिनर को टाइम चांस नहीं मिला MI के ऊपर पूछने के लिए, नेक्स्ट एग्जाम में पूछेगा. नाउ which incision is used safest in diaphragmatic surgery, doctor? Circumferential, it will injure less number of structures basically. Then circumferential or circumferential, okay. A person with renal transplant developing infection within 2 months. Post-transplant infections is a favorite area for the examiner. One question on transplant will definitely be asked. CMV. If you look at various infections, doctor, after the first month what will come? Viruses will come. Post-transplant. Human herpes virus group, which include CMV, herpes simplex, Epstein-Barr virus, Listeria, Nocardia are the pathogens commonly encountered whenever the infection is occurring after a renal transplant after 1 month is what you need to remember. Then after 6 months आने वाले infections क्या होते हैं? Respiratory viruses and chronic viral infections including CMV, they can occur after 6 months. Then within 1 month अगर infection आ गया after transplant, commonly कहां से आ रहे हैं वो? नर्स मेरी के नाक से आ रहे, nosocomial infection, right? So Aspergillus, Legionella, vancomycin resistant, Enterococcus, all hospital acquired infections are common post transplant whenever they occur within 1 month. So that's the point you need to basically remember. So most important out of all is the CMV. Advanced prostate cancer, I told you, one question on BPH or prostate cancer drugs. You have to review what is flutamide, what is leuprolide, what are the various anti-cancer drugs. Goserelin is the one which is being basically approved. So goserelin is LH-RH antagonist, luteinizing hormone. Releasing hormone is released from where? Hypothalamus. That LH-RH antagonist, if you give, you can decrease the LH production, you can affect the testosterone production, and if testosterone is not there, growth of prostate is further not supported. That's the idea, right? So that is the one which is being used. There is a medulloblastoma in a 1.5-year-old child. What is that you cannot do? Brain tumors is a high yield topic in pediatrics. Medulloblastoma doesn't have a capsule and it is located near the fourth ventricle, very close to all vital structures. Where do you have an opportunity to take a tumor margin? You cannot, right? At most you can resect. That's what you can be able to do. So surgical excision followed by radiotherapy and chemotherapy is what you can basically do. Nodular goiter is there in a female, what do you want to do? So basically FNAC will not help if it is follicular adenoma, because it can't differentiate follicular adenoma from carcinoma, right? But is there any role in the modern practice for if somebody presented with a nodular goiter, a female presented to you, do you want to do radionuclide scanning to differentiate whether it is benign or malignant based on whether it is a hot or cold nodule? No. That is an obsolete procedure. In the present practice of evaluation of a nodular goiter in a female, there is no role for radioisotope scanning as a routine procedure, is what examiner exactly want to know from you. Okay, doctor? Then a patient presented with diarrhea colonic diarrhea with blood on sigmoidoscopy, cauliflower mass is being found. Which important indicator in colon cancer is only useful when the colon cancer become advanced to prognosticate? It is useful only when colon cancer become advanced, not in the early stages of the colon cancer as what is being done here. KRAS. KRAS has a prognostic value only in stage 4 colon cancer, not in early colonic cancer. That's what examiner want to know from you. If KRAS is positive, what does it mean in advanced colon cancer? If it is positive, then the patient cetuximab, monoclonal antibody, it will be ineffective if the KRAS is positive. That is how you basically interpret. In the caregiver's hand, which Candida species is transmitted? Classically, it is parapsilosis. First time for me also. So, Candida parapsilosis is the nosocomial pathogen, not a commensal. A 4-day-old baby is there showing pneumatosis portalis and he is having necrotizing enterocolitis. Pneumatosis portalis is not pneumatosis intestinalis. Intestinalis is the gas in the wall of the intestine. यहाँ तक कहाँ है gas? Portal vein में gas है. अगर portal vein में gas है तो what is the stage of the necrotizing enterocolitis? For that you must know what is the staging. Stage 1, stage 2, stage 3. Stage 2 में you are having stage 2A, stage 2B. But where is the portal gas in this? Right? If the portal vein gas is there, it become stage, what happened? Stage 2B. That's what examiner want to know, whether you know that table or not. But necrotizing enterocolitis is a very hotshot topic in pediatrics. A child has albinism. You want to do which examination? Not here? Eye. Very good. So refractive errors, nystagmus, alternating strabismus, anything can happen in the albinism patient. So eye examination should be done. Olympian brown, bro and rugged. Classical of congenital syphilis. There are many more manifestations of that which you can review. 4-year-old girl, severe vomiting with viral fever, developed cerebral edema. So what is the likely possibility? Reis syndrome. That's the reason you will expect centrizonal hemorrhagic, you will expect microvesicular steatosis. That is what you need to basically remember. But what is the highlight in biopsy? You will only find microvesicular steatosis with no signs of inflammation because it is not viral hepatitis. And how does Reis syndrome present? Fulminant hepatic failure will be the presenting feature. Suddenly patient will go into comatose state because of that. Then what is the risk factor for hypoglycemia? Classically, the mother on beta blocker, mother with diabetes or IUG or anything, not post-dated pregnancy is what need to be remembered. The child is having hyperphosphatemia with the hypocalcemia. All other conditions, rickets, blah blah blah, will lead to hypocalcemia with hypophosphatemia, not hyper. Hyperphosphatemia means kidney is retaining phosphate. That happens only when there is any renal failure, chronic renal failure, chronic kidney disease, which can occur with a glomerulonephritis. So that is the reason high phosphate favors the answer as glomerular nephritis is what you need to basically remember. Typically there was a hepatosplenomegaly in a newborn with a gene sustain which is showing this. What do you see in this? Owl-eyed. Owl-eyed, where will you see? Typically in the case of CMV is what you need to remember. 3-year-old, 3+ proteinuria, no hematuria, nephrotic syndrome. Child may, what is the common cause? Minimal change disease. I think examiner, some questions he will be easier on us, right? Then 4-year-old, fever, cervical lymphadenopathy, strawberry tongue. Generally we are tempted to answer Kawasaki. Also possible is what? Scarlet fever. Which one do you want in your patient? Scarlet is easier. Huh? So doctor, there are criteria, diagnostic criteria to diagnose Kawasaki disease. We still have 38 online viewers in the game. They are not leaving any comments today. I think any cricket match today? No. On one side cricket, the other side class. The privilege will be there in a live online class. That's right. Are we going slow? No problem. I didn't get time to add illustrations. That would have made it more, much more interesting maybe. Okay. So I leave the literature for how do you diagnose Kawasaki. Maybe one more thing we can do to make this discussion interesting. Maybe we give it like a question paper beforehand. Will that make only questions so that you solve and then sit for discussion? We will be running faster maybe. We will try to do it next time. Enzyme replacement therapy, where will you use? Gaucher's is a condition. Most successful treatment by doing enzyme replacement therapy is what you need to remember. That's right. Speed is okay, sir. Yeah. Shravan is asking how to get seat in NIMS, sir. Yeah. You keep reading, one day you will discover. Right? I learned swimming very late. I learned when I am almost 36. Every time I used to get into swimming pool, I used to remember all forensic medicine. Wet drowning, dry drowning, chloride shift, everything. So my swimming teacher, I learned along with my kids how to swim. So the swimming teacher said, आप तो शुरू किया मगर थोड़ा लेट शुरू किया, कोई बात नहीं, आप एक काम करो डॉक्टर साहब, आप रोज स्विमिंग पूल में जंप करते रहो, एक दिन आएगा जब you will discover that you are floating and what you are doing all these days is drowning yourself. You stop efforts of drowning yourself, you will start floating. So how to get in NIMS or PG medical is keep reading high yield topics. One day you will discover any MCQ you are guessing correctly. That day automatically when notification matches, right? When your LH surge matches, ovulation also will occur. So if you are too early to that or too late after that, also no use. So keep preparing every day 10-20 topics you take and keep solving 30-40 MCQs. Slowly your confidence will build up within about 40-50 days. Let me tell you, 40-50 days if you go to reading room without break, you are different human than what you are today. That is the simple rule of preparation. Okay. But that 40-50 ko believe karna, I will be a different person, I will be solving, I will be getting a score more than 140. बोल के अपने आप को you have to believe and then go, start preparation. If you keep thinking that no, every exam I will keep getting low, I really don't read well, I am a bad student, वो सब सोच के बैठ गए तो preparation आगे नहीं बढ़ेगा. Let me tell you doctor, you are all immense minds of intellect. Let me tell you, you are those very few who got into medical school. So you need to re-accumulate all that energy, right? So asymmetric morose reflex, where do you find doctor? Brachial plexus injury and clavicular fracture are the two scenarios. Lethargy, hypotonia, resuscitation was done, and there are 2 episodes of seizures. Typically, which stage of hypoxic ischemic encephalopathy? देखो, पूरा stages के ऊपर है. Our stage will be decided. Earlier necrotizing enterocolitis का एक stage पूछा गया, ये भी एक stage है. हाँ, तो ये इसके लिए you must know Sarnath staging, right? He said alertness, muscle tone, seizures, pupils, respiration, duration के वजह से, I mean on basis के ऊपर how to basically divide the people of their hypoxic ischemic encephalopathy. I leave the literature for you. In this case, frequent seizures are there. Seizures are there in 2 episodes. इसलिए कौन सा स्टेज में आ गया? ग्रेड 2 में आ गया. Patient is having lethargy, hypotonia. Obviously, he is there in stage 2. If he is hyperalert, stage 1, coma, stage 3. So that's the point. So next AIIMS mein, you will read all this and go. Examiner will ask NEHA classification, JNC grading of hypertension, ADA criteria of the diabetes. That is life. Then a child of 7 weeks, cough is 48. Respiratory rate is 48 with cough, otherwise normal. Isko pneumonia hai kya? WHO has given guidelines how to define acute respiratory illness in a child based on respiratory rate. So he doesn't have any pneumonia. So no role for antibiotics, fever must be treated and child don't need any special resuscitation. So ARI criteria of the WHO you need to revise, doctor. Then patient is having hemoglobin level less than 5, joint swelling, bleeding spots, 3 years of age, what is the possibility? Anemia commonly is because of hookworm infestation which lead to development of anemia. A picture of anencephaly was given and the examiner asked, what is this? Not even examiner asked banana sign on ultrasound, lemon sign on ultrasound, utna level ka bhi question nahi hai ye. Directly without head, don't tell head injury of a newborn baby. So anencephaly is what you need to remember. Then hysteroscopy से मायोमेक्टमी कर सकते या काट के चीर के ओपन हिस्टेक्टमी कर सकते, मायोमेक्टमी. इन दोनों के बीच क्या फर्क है? So basically recurrence is a thing whether you do hysteroscopically or open myomectomy, both of them more or less equal, no difference, but pain will be lesser. Early ambulation if it is hysteroscopic and less bleeding will be there if it is hysteroscopic is what you need to remember. Pubertal changes, pubertal growth in females, why does it basically, what will happen during that time? One question on puberty, doctor, Thilark, Menarche, precocious, when do you call, everything, Panda, you have to finish. So, pulsatile release of the gonadotropins occur during the sleep at the time of the puberty. It is a pulsatile release of the gonadotropin releasing hormone responsible for FSH and LH to get released is what you need to remember. In cesarean, you can also do vaginal delivery. What is that called? VBAC. Right? So, after cesarean, when to do vaginal, when to do cesarean only is an important discussion. If there is a breach, macrosomia, postpartum pregnancy, previously cesarean हो गया तो अभी भी cesarean करना पड़ता. So, when will you do VBAC? What decides the success of VBAC? ACOG guidelines. I leave the literature for you. You need to review that. Then, doctor, what is contraindicated? We were all expecting ACE inhibitor, but diazoxide also is contraindicated. Superimposed preeclampsia define करने का, what is the criteria? Suppose already patient is having hypertension in the background, doctor, chronic hypertension before pregnancy only. Pregnancy आने के पहले अगर BP 140 है तो this time if the systolic BP is 30 mm more, diastolic more than 15 than earlier BP, that defines superimposed. Similarly, any new onset proteinuria, platelets less than 70,000, any of them occurring with the background of previous hypertension defines superimposed preeclampsia. इसमें vascular changes are not included in the criteria. HELP syndrome में there is no retroperitoneal hemorrhage, but hemolysis, elevated liver enzyme and low platelets is what need to be remembered. Then cerebral angiography में puff of smoke. Actually, I could not get the next time I will give in one of the mock tests an image of actual puff of smoke ke jaise and check whether you can discover moya moya or not. In Japan, what is the meaning of moya moya? If Japanese say moya moya means smoke is coming out. So it is a progressive arteriopathy. Why it looks like a smoke when you do angiography? Because of this arteriopathy, there is a narrowing of the internal carotid artery and development of collaterals. All these collaterals look as if smoke is rising up. Hence called moya moya disease is what need to be remembered. ये तो DM न्यूरोरेडियोलॉजी लेवल का क्वेश्चन है. Homogeneous isointense on T1 and isointense on T2 with high contrast enhancement. Which is the lesion out of all this? Cruel no doctor. Out of syllabus. It is within MBBS syllabus बोल के बोला ना. तो हाँ, choroid plexus carcinoma. That will be T1 iso. Sorry, if you take glioma, T1 will be iso, T2 is hyper. Whereas choroid plexus papilloma may T1 is hypo, T2 also is hypo. That's how you recognize and differentiate the two. Head injury patient may what is the best ventilation you want to give? So generally initial period may head injury may controlled mechanical ventilation CMV mode is best one so that it will avoid hypercapnia and provide good oxygenation. बाद में if you say SIMV synchronized intermittent mandatory ventilation means what? एकदम पेशेंट लेता एकदम वेंटिलेटर लेता और एकदम पेशेंट लेता और एकदम वेंटिलेटर लेता. Synchronized intermittent, if it is if the patient's ventilation is falling below certain level, then the ventilator will blow. That's called synchronized. Weaning time पे इस्तेमाल करते हैं उसको. Even CPAP also. CPAP is a non-invasive form of ventilation. Before how many days of surgery lithium should be stopped? Actually, if you take half-life of lithium, 48 hours is the answer. 2 days. Because based on half-life. But general protocol in the anesthetic theatre is, if a depressive, maniac depressive is coming for surgery, regularly taking lithium, stop that lithium for that day. Because who is supposed to be in mania in theatre? Surgeon is supposed to be in mania, not the patient. No, so stop the lithium of the patient and 1 day before. You can remember. These similar questions will come in exam. Hypertensives, when you should stop. Type 1 diabetes high, insulin, when you should stop. So which drugs to be stopped, which should not be stopped at the time of the D-day of surgery, you must be quite sure about. Laryngeal mask airway for a normal adult will be generally of the size 4 or 5. Number 4, number 5. Suppose if the patient's weight is given, especially pediatric patients, may common question asked. Patient's weight is given to you. What should be the LMA size is what examiner will ask. उसके लिए formula मालूम होना आपको. The weight of the patient divided by 5 into 0.5. अगर पेशेंट का वेट 15 kgs है पीडियाट्रिक पेशेंट का 15 by 5 is 3 into 0.5 is 1.5. The nearest is number 2. Number 2 LMA is what you will take, right? So don't forget that. Supramac, if you are giving an anesthetic agent beyond the minimum alveolar concentration, what is the effect that will have on EEG? ये भी super duper question है पूरा over the head. Negative exam में don't touch this kind of questions. Theta become delta. Nobody among our classmates know that. Be very sure on that, right? Most common rib fractured in resuscitation. Think about your housemanship days and answer. T4 to T6. Then एक anesthetic agent which will rise BP, rise ICP, rise IOP, उसके बिना entrance होता क्या? नहीं होता. तो it will not affect. Nitrous oxide does not affect. Thiopentone, actually answer should be altered to B, not C. Thiopentone doesn't alter, all other will alter. What is stage of surgical anesthesia? Goodell staging. Basically story thoda lamba hai, stage 1, stage 2, stage 3. Stage 3 is called surgical anesthesia. So during this what will happen? Skeletal muscles relax, vomiting stops, respiratory depression occur, eye movements will slow. This is basically called stage 3 is what you need to remember. So doctor, lastly we have another 15 questions more that we can finish and say we are done with the karma and kismat of AIIMS May 2014, and pray that you will get seat before AIIMS May 2015. So that is the plan. So Shravan says, proud to be your student, sir. In fact, we are proud to be your teacher because you are making our life worthwhile to be part of your preparation. Now doctor, Bankert, Hill Sachs, the 2 lesions in the shoulder dislocation are unforgettable. Antero-inferior part. What is meant by reverse Bankert? Infero-postural labrum. Whenever posterior dislocation is there, you get reverse Bankert is what need to be remembered. In children, supracondylar fracture में malunion है. जहाँ malunion होगा, non-union नहीं होगा. Non-union होगा, malunion नहीं होगा generally. But दोनों कुछ चीजों में दोनों होते हैं. तो you get know that gun stock deformity is malunion, right? Young male, daily morning stiffness of spine, reduced chest movements, classical example of ankylosing spondylitis. After knee replacement, total knee replacement surgery, what happens to the movement? Actually movement improves because knee replacement में क्या करते हैं आप? दूसरों का knee ला के नहीं लगाते. You will trim the lower part of femur, upper part of the tibia, trim it and put a steel, and they will be touching each other. So no more pain. So that's what you are doing. You are putting 2 caps here and below and above. So movement become better. What suggests that there is a malignant change in chondrosarcoma? The thickening of the cartilage cap is the one which is a very important specific feature that is suggestive in chondrosarcoma. There is a head injury and also femur injury. So this is a simple question, A, B, C, D. Airway is first, so intubation is first. That's what you need to basically do. A chronic alcoholic presents to you and he has no epileptic history. Hospital में शामिल शरीक करने के बाद 2-3 दिन के बाद उनको सीजर्स हो गया. उसको क्या बोलते हैं? रम फिट्स बोलते हैं. Withdrawal seizures of alcohol. So how do you basically manage? Benzodiazepine is the treatment of choice for alcohol withdrawal. Diazepam is the answer. Clever-Goosey syndrome. Recently also we have seen one of the state entrances. Very favorite question of the examiner. Hypersexuality, hypermetamorphosis, placidity and psychic blindness. They are all the features whenever there is any injury to the limbic system, etc., etc. 16-year-old female, recurrent abdominal pain, ultrasound is normal, suddenly tells that there is a loss of vision. What is the possibility? Any sudden bilateral loss of vision, young female, you should suspect possibility of hysteresis, malingering, etc., etc. A child is not eating vegetables. Mother says, I will give you a chocolate, and he finishes the vegetables in the diet. So What is this method basically called as? Why not classical conditioning? Why call operant conditioning? Classical conditioning hota hai Pavlov's experiment. Your natural reflexes itself will reward your mind for you to execute. That's called classical conditioning, right? Like every time you are giving a treat, when your senior PG is teaching you, giving you a chance in the OT, what conditioning you are doing to your senior PG? Classical or operant? Operant conditioning. But every time your PG is seeing you, he felt that he is my junior. If not me, who will teach him and take you and teach? What is that called? Classical conditioning, right? Then, so chocolate is called positive reinforcement, and whenever there is any reinforcement and conditioning is happening, what do you call it as? Operant conditioning. Without that only, if it is happening reflexly, then that becomes classical conditioning. Cognitive remediation is used in which scenario? For the memory improvement, schizophrenics also. Cognitive remediation therapy, also called enhancement therapy, to improve the attention, working memory, cognitive flexibility, planning, etc. etc. All causes of psychiatrical, non-psychiatrical alopecia must be there in your tips when you go for the entrance exam, doctor. Alopecia areata is a classical example. Similarly, androgenetic alopecia, telogen effluvium, anagen effluvium, traction alopecia, they are all considered to be non-psychiatrical alopecia is what need to be remembered. What are the various things with which alopecia areata is associated? Pitting nails, atopy, exclamation sign. The hair will look like a question mark, right? So that is what you will typically come across. Vesicular eruption, dermatomal pattern. Zoster is what? Chicken pox. Childhood mein chicken pox, adulthood mein relapse is called zoster, herpes zoster. That is not simplex. Oral mucosal lesions, flaccid blisters. What is the favorite two topics in dermatology? Pemphigus vulgaris, naito bullous pemphigoid. So this is pemphigus vulgaris, which is basically pathology shown in epidermis. All other are dermal pathologies. So this is fishnet pattern IgG in epidermis is what need to be remembered. A young boy, multiple shiny pinhead sized white papules on the dorsum, penis and forearm. There was once more a straight repeated MCQ from AIIMS November 2013. So it is called lichen nitidus is what need to be remembered. Okay. So flat topped violaceous papules with the thinning of the nail. All this describes classical. What are the four P's? Papular, pruritic, polygonal, purpuric lesions of the lichen planus. So there is a basement basal cell degeneration which is histological hallmark of lichen planus. After scratching the hand with a pen, if there is any bump appearing, that is called as the dermographism is what need to be remembered. Young patient is having comedones and papulopustular acne. How do you want to basically manage? So basically he is having papulopustular acne. So that is the reason oral antibiotic along with retinoid. Acne is another very standard topic. Only 20 topics in dermatology. 7-year-old, right-sided vascular malformation, left-sided focal seizures. So which neurocutaneous syndrome are we talking about? Stooge-Weber classically is leptomeningeal angiomas along with neurological abnormalities, the combination. Now a clinical picture was given of a patient, not the same one, similar one. So what is this called as? Hypopigmented macules called ash leaves. Then what are these things that you are seeing here? They are classical of facial angiofibromas. So what is that? Basically tuberous sclerosis. What type of inheritance pattern will it follow? Autosomal dominant inheritance. That is what is examined. So you are expecting some image based MCQs in the future, APPG, TNPG, Kerala PG. Questions will be simple like this. Then coarse pitting of nails with onycholysis. What is the most likely etiology? So basically psoriasis. Psoriasis may you have pitting of nails, onycholysis, right? So naturally psoriasis is recognized because of well defined scaly plaques becomes the answer. Then that is all. Last 12 questions, no student could recall what were there. So once more, thanks for a patient listening, doctor, and let me tell you, COMEDK 2010, 11, 12, 13, 14, 5 papers. Already we finished discussion. They are unemployed for the past 5 years. What 5? 1.5 decade. So all those video discussions along with the complete questions and explanations will be hosting by tomorrow in the newsformedico.com, right? Under the COMEDK heading. You can click and then review those videos. Nearly, they are very good questions. 180 into 5, 900 questions are worth revising, right? Because once more same recall will be there in the actual examination. And before the state MD entrance in March, once more February May we will have one more COMEDK. So we will also have a discussion on that. So by tomorrow evening we will upload that. Okay. Then some of the PDFs of the high yield topic notes we have recently, yesterday only uploaded. You can go to the download section and download those who did not those notes. And thanks for a patient listening. And tomorrow evening 4 to 8 we have SPM class, and day after tomorrow we will have a good fight of mock tests. Prepare well and come. Yeah.